Spicy, and I am here to just give a 10-minute or less description. 1 second. We're going to start over. Hello, everyone. Pauline from ChronicallySopicy, and I am here to give a 10-minute or less description on relapsing polychondritis, which is why I am in Florida, because I have an appointment tomorrow with a specialist, a dermatologist who is familiar with the condition, has diagnosed and treated patients, and was recommended to me by name by by a dermatologist in my physician's office, my regular GP's office. So we drove the hour and a half, and we're in a hotel because tomorrow might be a lot of answers. Relapsing polychondritis. All right, let's go. What is it? Relapsing polychondritis, RP, is a rare autoimmune condition which presents as recurrent episodes of cartilaginous inflammation of the auricular, nasal, and tracheal cartilage. Your skin gets jacked up. My pinned post with all the sores on my arm, that's that, or I think it's that. The first case was described in 1923 of a 32-year-old patient presenting with fever, pain, and swelling of the ears, and later external auditory canal and saddle nose deformity. And you get because some patients with this condition do need to eventually have reconstructive surgery on their nose and or ears. A biopsy showed cartilage absence, and the term relapsing polychondritis was coined by Pearson and his coworkers in 1960. Objectives, let's see, introduction. Relapsing polychondritis, RP, is a rare autoimmune condition which presents as recurrent episodes. We already talked about that. All right. The etiology of relapsing polychondritis is not known, so the cause, not known. It's suggested to occur in a genetically predisposed individual on exposure to a triggering factor, just like a lot of chronic illnesses. There's a triggering factor. Even celiac disease is something that you can be born with and have, inactive for the longest time, and then, just a switch is flipped, and suddenly the pizza that you were enjoying now, hates you and makes you hate life. By the way, this inflammation in my eye may be a sign. Maybe one is listed as a symptom of relapsing polychondritis. We're going to read this one, Cleveland Clinic. All right. So it's a rare disorder causing inflammation and deterioration of cartilage connective tissue. Basically like super EDS, but bad. Symptoms often include pain, swelling, and redness in the ears. The condition can also impact the nose, airways, and other body parts. Most people can manage episodes with medications, but complications can be life-threatening. If I have this, I suspect that I've had this for at least 10 years. Possibly 16, because everything went haywire after my daughter was born. What is it? Rare disorder, cartilage, connective tissue throughout your body. It's and it typically affects ears, nose, larynx, voice box, and trachea. There's other names for it. It can affect anyone, but usually starts in people ages 40 to 60. And how common? Very rare. Researchers estimate that it affects 1 in 285,000 people. Causes, unknown, but some consider it an autoimmune condition when your immune system attacks healthy tissue and they don't understand why it happens. Symptoms, and you only have to have 3 to have a positive diagnosis for RP. Tends to occur in episodes of flares. 1. An episode may last a few days, weeks, and they occur repeatedly for years. Mine happen in flares. I go like a couple of years, I'm fine, and then I'll have like anywhere from 3 to 9 months of absolute hell. The first symptoms are usually pain, tenderness, and swelling and redness in one or both ears. That does happen to me. The symptoms affect cartilage inside and outside your ears, but not your earlobes. Your ears may become floppy. I can literally feel my ears flapping in the wind on windy days, guys. Other relapsing polychondritis symptoms include, wait a second, I lost. Ears, floppy. That's 3. Other relapsing polychondritis symptoms include saddle nose deformity. I don't have that. Joint pain similar to arthritis. I don't think I have that. Nasal congestion. I usually have that. Pain and redness in your eye. Difficulty breathing. It affects if it affects your trachea, or trouble speaking if it affects your larynx. I occasionally get like vocal dysfunction, some kind of vocal dysfunction, that like interrupts words. I don't know how to describe it, but it's happened enough during a few of my TikTok lives that regular followers have pointed it out, and will jump in the comments and tell me to take my rescue meds. Rarely, someone with this condition can also have heart valve issues, heart murmur, vision loss, and kidney disease. Management includes a variety of medications that I'm probably allergic to, because they all contain derivatives and dyes, which means they contain ethylene and diamide hydrochloride. But one on the list is NSAIDs, which I can take, and I did find some research showing that the Benz class, that is a mast cell stabilizer, could also potentially help with RP symptoms. And I will tell you, when my skin starts to get all hard and the sores start and it hurts and I start panicking, I take my medication, and not only does my panic go away, the physical symptoms stop progressing. So I won't be able to take corticosteroids or prednisone because that contains ethylene diamide hydrochloride. So that's out, and so are the other options. You can't prevent it because the scientists don't know what causes it. Is it fatal? Almost 95% of people with the condition are alive 8 years after diagnosis. I want to know how long it takes for the average diagnosis, because I've had this for anywhere from 10 to 16 years now that I'm aware of. Usually it's it can cause life-threatening complications, particularly breathing problems, and can cause permanent loss, scratch usually, but it can cause life-threatening complications, particularly breathing problems, and it can have the result of permanent loss of hearing or vision. How long will I have it? It's a chronic illness, you guys. Question to ask your provider: how severe is my condition? What medications do you recommend? Should I have tests to check on vision, hearing, airway, or heart, or kidneys? Should I see any specialists? Can I do anything to strengthen my cartilage or slow down degeneration? And do you know of any medical or clinical trials for this condition? And that is from the Cleveland Clinic. I will provide the link in the description box on the YouTube channel. Please subscribe over there. It's free, and you can click the links. If you want to subscribe to your favorite content creator on TikTok, you have to pay. TikTok, free. So I'll see you over on YouTube. Have a great night. Okay, so ending that stream. Stick around because I'm going to do one on Magic Syndrome. 1 second. And one on Bayshot Syndrome. And I'm just doing the fast versions for the 10 minutes, and then I can break those down later. Because for some reason I got banned from TikTok Lives. Or not, I don't even know for how long. I'll have to look and see. Let's look now. How long have I been banned? Let's just do testing. And then it'll tell me. What? I thought I was banned from TikTok. I thought I got kicked out.
You said it said live access restricted.
What the? Apparently I'm still allowed on TikTok or for lives. Hi everybody. All right. So I'm gonna end this, and I'm gonna start another one if you're on YouTube, hanging out on YouTube or Facebook. Actually, this one was just YouTube. So I'm gonna start another one. Hang around because I'm gonna do another one on Bayshot's disease. See you in a few in the next video. I love